Coping methods for millions of Americans struggling with mental health or substance abuse have become more difficult as people self isolate.
1 in 10 Americans struggles with addiction today. And with the COVID-19 crisis, that's only getting exacerbated with social distancing and people being isolated, where all of the in person support meetings are now shut down.
Entrepreneur Daniela Tudor and former professional tennis player Murphy Jensen, both in recovery, have begun offering free online support meetings through their app We Connect Health. Teletherapy isn't a new concept, and federal agencies like the Centers for Medicare and Medicaid Services are encouraging its use during the pandemic. Shortages of mental health professionals, the cost of treatment, and social stigma are just some of the significant barriers to mental health care access facing many Americans. For these people, teletherapy may be a game changer during the pandemic and beyond.
We can't do the ideal right now. So the next best thing, it seems to me, and I think that the research would back this up, is to do teletherapy. And I think that we're probably going to be seeing the mental health community will probably be changed by this. And there probably will be more telehealth services.
Still, for people recovering from addiction, the coronavirus crisis could trigger relapse. Social media is filled with posts about using drugs and alcohol to ease anxiety. The same pressures exist for those working to overcome disordered eating.
A very important piece of the recovery process is being part of a community who understands what it is that you're going through. And also, prolonged self-isolation can actually begin to reinforce the problem again, so that people who are, when they're by themselves, may be more prone to drinking or using because they're by themselves so much. We're not meant to be apart from other people. And yet the irony is this is exactly what we have to do in order to survive.
On the other hand, some in recovery prefer online support groups, which may offer more affordable services anywhere and at any time. Of course, not all who are struggling have access to webcams or private places for phone calls, but experts say staying connected as we social distance is crucial.
I think the most important thing through COVID-19 is the fact that is with people with substance use disorders that they stay connected and plugged in and leverage any and all technologies possible. It was my experience that addiction was centered around my own isolation, being on the phone, sending text messages. I think making sure that my home is a safe place from triggers is something that's key.
Shira Tarlow, Newsy, Washington.